How to use naloxone, an educational video. Naloxone, also known by the brand name Narcan, is a medication used to reverse opioid overdoses. Some common opioids include oxycodone, hydrocodone, morphine, methadone, buprenorphine, fentanyl, heroin, and carfentanil, but there are many others. Naloxone does not reverse the effects of non-opioid drugs such as cocaine, methamphetamine, alcohol, or benzodiazepines such as Valium or Xanax. Naloxone temporarily blocks the effects of opioids to allow an overdose victim to start breathing again. It starts working in 2 to 5 minutes and lasts about 30 to 90 minutes. Illicit drugs, even those that may look like prescription drugs, are unpredictable and could be tainted with opioids like fentanyl. If an overdose could be due to opioids, it is okay to administer naloxone. In an overdose, the overwhelming effects of a drug cause body systems to start shutting down. In an opioid overdose, this means that the brain has a hard time telling the lungs to breathe. Signs of an opioid overdose include no breathing or extremely slow or shallow breathing, not responding to shouting or touch, turning blue, purple, or gray, especially in the lips and fingertips, and making choking, snoring, or gurgling sounds. Now, let's go through the key steps of what you should do if you believe that someone has overdosed. The key steps include calling 911 and administering naloxone for overdose. Step 1, try to rouse the person. Call their name and ask if they can hear you. Firmly rub your knuckles up and down the center of their chest. Press hard. This is called a sternal rub. It is very uncomfortable and is the best way to check if a person can respond to you. If they do not respond to you, call for help and dial 911. Step 2, call 911. Describe where you are and what the person is doing. Keep the operator on the line. They can help walk you through the next steps. If there is another person with you, let them talk to the operator as you start step 3. Step 3, give naloxone. Peel open the packaging and remove the nasal spray. Place your fingers on either side of the nozzle. Do not test the spray, the dose is already prepared. Place the nozzle in one nostril until your fingers touch the bottom of the person's nose, and firmly press the plunger to dispense the whole dose into one nostril and remove the nozzle from their nose. Step 4. If the person is not breathing and has no pulse, start rescue breathing and chest compressions if you have been trained or if the EMS dispatcher provides instructions. If you have not been trained on this, do not worry. Position the person lying down on his or her left side with the knees bent and arms in front. This is called the recovery position. Step 5, second dose of naloxone. If the person is still not responding after 2 minutes, give a second full dose of naloxone in the other nostril. Resume rescue breaths and chest compressions if not breathing and no pulse, if you have been trained to do this. If they wake up, try to keep them calm and be happy you just saved a life. Step 6, monitor until help arrives. If the person regularly uses opioids, they may have withdrawal symptoms such as vomiting, diarrhea, sweating, or agitated behavior when they wake. Agitation and confusion when waking up can occur because normal amounts of blood and oxygen have not been getting to the brain. These symptoms can be very dramatic and uncomfortable, but are not life-threatening. It's important to make sure they do not take any more opioids, or they may fall back into overdose as the naloxone wears off. Naloxone only lasts 30 to 90 minutes, while some opioids can stay in the body for more than 12 hours. Watch the person carefully for signs that they are starting to overdose again as the naloxone wears off. Encourage treatment, which can be started after overdose and relieve withdrawal symptoms, and stay with the person until emergency services arrive. Recovery position. If the patient starts to breathe again, or if you have to leave the person for any reason, put the person into the recovery position. Roll the person onto their left side with the knees bent and arms in front. This will keep them from falling onto their back and choking if they vomit. Even during the current coronavirus pandemic, opioid overdose warrants a really fast response, with calling 911 and giving naloxone, because the likelihood of a life-saving rescue is high. If you have gloves and something to cover your face, like a face mask nearby, please put those on. If you do not, please still call 911 and administer naloxone. Wash your hands or use hand sanitizer if possible. If at any time you need to cough or sneeze, Do that into a tissue or into your sleeve or arm. Now that we know how to respond to an overdose, let's talk about how to prevent one in the first place. People are at higher risk for overdose if their tolerance to opioids is lowered. This can be caused by pausing opioid use for even just a few days. People who were recently in jail, in a rehab program, in a hospital, or otherwise stopped using opioids are at high risk because they cannot handle the same amount of drugs that they were previously used to taking. Another risk factor is mixing different drugs or medications. Mixing opioids, especially with other downers like alcohol or benzodiazepines or benzos, can make naloxone less effective and increase the likelihood of an overdose. Likewise, using drugs that are stronger than normal can increase the risk. Always be cautious when using a different prescription opioid or when using from a new supply or dealer. Fentanyl, a very potent opioid, may be mixed into the drug supply, making drugs much stronger than usual. This is hard to detect and dramatically increases the risk of overdose. Other people at high risk include those who are sick, dehydrated, or have a chronic illness like lung or heart problems. And once a person has overdosed, their risk of overdosing again is very high. The biggest risk factor for fatal overdoses is using drugs alone because there is no one to call for help or administer naloxone. Avoiding these risk factors is important in reducing your chances of overdose. Be cautious when switching between opioid medications or when using from a new supply or dealer. Do not mix opioids with benzos or alcohol. Never use opioids alone or when no one knows where you are. And if someone relapses or starts using opioids again after a break in using, they need to use a much smaller amount than they were typically used to. If you or a loved one are struggling with opioid use or opioid use disorder, please seek medical help. There are medications that control cravings and prevent withdrawal and overdose and are available as treatment options for opioid use disorder. You are not alone. There are people who can help you. Visit findhelpnowky.org to see what treatment facilities are accepting new patients. Lastly, here are a few tips on carrying naloxone. Make sure to store it in a safe yet easily accessible place. Let others know where the naloxone is and direct them to this video to learn how to use it. Make sure to store naloxone in a dry place at stable room temperature. Also, check your naloxone packaging for its expiration date. If your naloxone is expired, talk to a doctor, pharmacist, or public health department about replacing it. However, remember that expired naloxone is better than no naloxone. If your naloxone is expired when someone is overdosing, still call 911, give the naloxone, and tell the first responders that it was expired. Finally, let's review what you've learned. Naloxone is a medication used to reverse overdoses from opioids such as prescription pain medications and heroin. If you suspect an overdose, check for response with a sternal rub. If the person doesn't respond, call 911 and give naloxone by spraying the full dose into one nostril. If you know how, give rescue breaths until the person is breathing on their own or EMS arrives. If the person hasn't woken up after 2 minutes, give a second dose of naloxone. Always stay with the victim until EMS arrives. If you must leave the victim for any reason, roll them onto their left side and into the recovery position. It's important to remember that many drug overdoses can be suicide attempts. The National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week at 1-800-273-8255. Also, to learn more about providing life support, including CPR and rescue breaths, and to get certified, visit www.redcross.org/local/Kentucky/take-a-class. This video was developed by the University of Kentucky's Healing Community Study team. The production of this video was supported by the National Institute on Drug Abuse. For more information on the Healing Community Study, visit www.healingcommunitystudy.org.